Now, if the thyroid gland is too high, that is, there is too much thyroid hormone in the body. This can either be because you're taking thyroid hormone levels that are too high, or there are certain diseases, Graves' disease, certain autoimmune diseases that may make or turn the body into a hyperthyroid state. And these are the things, if you're on thyroid medication, you need to be aware of so you can recognize your overdosage state. Tachycardia, that is, the heart rate goes up. Tremors, there's just a little fine tremor in the fingers. Anxiety and weight loss. Of course, that's why most of us want to be on high thyroid, is for the weight loss. Graves' disease is the classic autoimmune disease that causes high thyroid, has all the symptoms that we just talked about, and there is also a edema behind the eyes that actually pushes the eyeball forward and gives the classic sign of Graves' disease, with the eyelids that don't close easily, and it's a larger eye. Also, typically with Graves' disease, you can actually feel the thyroid gland. Most of the time, you cannot feel the thyroid gland unless there's a nodule, a cyst, or it's enlarged. A lot of us have heard about the term Hashimoto's disease, which is a thyroid autoimmune disease. An autoimmune disease is when the body finds an organ or a tissue that is going to attack. It has identified it as the enemy, just like it identifies viruses or bacteria or cancer cells as the enemy and goes on a rampage trying to get rid of it. An autoimmune disease is where the body has somehow identified normal tissue, now the thyroid gland, as the enemy and starts to attack it, causing inflammation. And it may cause the thyroid to be stimulated. It may actually have a normal thyroid state or a low thyroid state.